Hi everyone, welcome to POC Nurse. My name is Gozi. In today's video, we're going to talk about how I got a high-paying home healthcare job as a nurse and my experience during the interview, my orientation, and what I experienced while I was working. So first off, why did I go looking for a home healthcare job? All of the jobs I've ever had have been in the hospital. I worked in L&D in the hospital. I worked in the ER in the hospital. I currently work in critical care in the hospital. I've done tele and I've done PCU. I got floated to those two places from working in the ICU. I never took a full-time job there really, but I worked in those two places. I also worked outpatient in the surgery centers, which I had to also travel to a facility and stay there and work there. So throughout my nursing career, I always dreamt of having some flexibility. Sometimes I'd wonder if I could work from home, like get a remote job. Recently, I started thinking about looking for a remote job because I'd go on YouTube and see these nurses talking about how they're working from home as a utilization review nurse or as a case manager. And I also have a nurse friend that works as a case manager from home during the week. And then she does ICU here and there in the hospital. So I thought, okay, it is doable. Let me look. I looked, I couldn't. And I applied for case management jobs, for utilization review jobs. I never got called for an interview. My applications were acknowledged, but I never did get called for an interview. So I was still working in the ICU, talked to another nurse friend. She does the ICU on the weekends, and during the week she would do home health nursing, but hospice home care. So I was like, well, I'm looking for something right now where I could either work from home, take my kids to school and pick them up, or something where I could kind of take them to school, go to work, be in the neighborhood in case something happened, and still be able to go pick them up or address whatever issues come up. Like I wouldn't be tied up in a facility that's like a couple minutes away. I'd be like in my area. So I decided why don't I look for a home healthcare job? Because I did community health nursing in nursing school. So I was like, okay, yeah, that's what I'm going to do. I'm going to look for a home healthcare job around where I live, drop my kids off, go to work, see my patients, go back home, pick up my kids, and be home with my kids. Be home and be present. So I went on Google, I put in home healthcare RN jobs, and all the jobs came out. And I noticed one job was close to me, close to where I live. So I decided to apply to that agency, the home healthcare agency. I applied. Someone reached out to me about setting up an interview. They wanted me to interview the day after they contacted me. So if I applied on a Monday, someone reached out on a Tuesday and wanted to see if I could come interview on a Wednesday. And I said I could come on a Thursday. So I prepared myself, kind of put my outfit together, what I was going to wear. And if I needed anything, I went and bought it. And then I went on the interview on Thursday. Now, during the interview, because I've never done home health care, the interviewer was kind enough to explain what the job would entail. So I was thinking I was going to be drawing blood and doing all this stuff that I did bedside. I just transferred over to the home setting, but that wasn't the case, at least for this agency. The interviewer told me I was going to be doing a lot of education. The goal was to keep the patient in the home, to help them recover in the home and prevent rehospitalization. And I'm thinking, you know what, I could do that. She explained that there would be some procedures involved. I may have to do wound care, which is okay. Change Foleys, place Foleys, take care of ostomies, things like that. But we weren't going to be giving medication. We weren't doing AccuChecks. What was the other thing? I don't remember. We weren't going to be doing anything invasive. Most everything would be like small procedures and a ton of education. So I was excited. I said, I could do that. I love education. And then she went on to explain some other things to me, which I should have taken note of. I did take note of what she said, because it's something that happens to us nurses all the time, where you're expected to fill multiple roles, including your role as a nurse. But because I hadn't done this job before, I didn't really know what that looked like in real life. So she explained to me that I was going to be the nurse. I was also going to be the case manager. I was going to do admissions. I was going to do discharges. I was going to do the regular visits. And I was like, okay, we're nurses. When you work as a nurse, if the clerk is not there, you're the clerk. If you don't have an OR tech, you're the OR tech. If you don't have a PCT on the floor, you become the PCT. You help each other out. You run your own specimens to the labs. You go pick up your blood. You do everything on your own. So I was kind of used to that already. So when she was reading off, you're going to do this, do that, do the other thing, I'm like, in my mind, what else is new? It's normal for us nurses to wear many hats at one time. So I think she, on her part, was trying to be transparent about what this job was going to be like. Because she had asked me why I applied for the job, and I was honest. I told her I'm looking for flexibility. I want to be able to work, but have time with my family as well. I want to be more available to my family. She said, you're going to have some flexibility, but I don't think you're going to get as much flexibility as you're looking for. And, I said that, I can work with some flexibility. So I think she was trying to prepare me for what the job was really going to be like. But I had no frame of reference. I had nothing to, refer to that would tell me how this job was really going to be like. But, I was open to seeing how the job was going to be. And from what she explained, it was all things that I could do. I just did not think about, how much time will it take me to do all these things, even though I can do them? How will it affect the flexibility that I'm looking for? See, all these things didn't cross my mind. And I bring them up now because in hindsight, I was saying to myself, that's when I should have kind of figured out that this job is going to be very time intensive. But even then, I didn't know how time intensive it was going to be. But anyway, moving on. So she explained what the job was. I asked a couple of questions and we got along very well. I like her a lot. She was a very supportive boss. So she told me what the salary range was going to be. She said, I'm just going to kind of give you an idea here. She said the pay was going to be between $90,000 and $10,000 a year. I was expected to work 40 hours a week, 8 hours a day. She told me I had to hit certain benchmarks for productivity every week. So I think I got, you have to get like 5 points a day, which is 25 points a week. And the kind of patient you see a day would dictate how many points you get for that visit. So if you do an admission, it's 2.5 points. Almost everything else was 0.75 points, with the exception of a few things here and there. The least amount of points you could get is if you make a phone visit to the patient, if you call the patient on the phone and do the official paperwork associated with it. So if you call a patient kind of on your own to follow up on something, it doesn't count. So for that, you get 0.15 points. So I said, okay, all of this sounds doable. There are nurses doing it already. So, how hard can it be? So, remember the salary range she gave me was between $90,000 and $110,000. And she said what you get depends on your experience as a nurse and your experience in home health care. I had zero experience in home health care, but I've been a nurse for over 10 years. So I'm thinking there's no way she's offering me the low end of the pay. Of course, she has to move me somewhere in the middle. But when I got the offer, she offered me the job that day. I said, I'd think about it. I think the next day I told her I'd take the job, and then I got an offer letter in my email. Everything moved pretty fast. I got the offer letter. The offer letter, on the offer letter, I got the lowest salary, which is what you'd give what you pay a brand new nurse. So, I got the offer letter in my email. So I wrote an email back, explaining that I wasn't a brand new nurse. I know I'm going to need some training, but I need the pay to reflect the experience that I do have of being a nurse for over 10 years. I only need training for how home health care works. But when you talk about patient assessment, I really don't need any training on that, how to take vitals, listen to patients' lungs, interview the patient, see what's going on. I just need to know how home health care works. Now, this is what I was thinking to myself. In my email, I just said, I have all these many years of experience, and I don't think this current offer reflects that, and I would like for the pay to be reviewed. And so she did end up paying me more than that base salary, and I accepted. So I went. I did my orientation in the office. It was a lot of modules that I had to do. And while I was doing the modules, I would go visit patients with some of their field nurses. I also went to see patients with their physical therapists, which was awesome because I got to see what they do and how to, kind of know when to recommend physical therapy for a patient. I also went out with the occupational therapist. So it was awesome. Now, during the interview, I forgot to mention, and like I was saying, the interviewer was trying to be as transparent as possible. She was trying to let me know everything that would be involved in the job. She told me that I would not be seeing patients really where I lived because they already had nurses in that territory. So I was going to get the next city over, which was okay for me. But then she also said, even though I'll be getting the next city over, that I may be required to see patients in other cities. So I'm thinking, all the places she's telling me I'd be required to go, they're not too far away. It's like 30 minutes, 40 minutes. It's not too far. But me saying those things to myself was based on going to those places once in a while, not all the time. And sometimes, because we go someplace once in a while and we're not in a hurry to get there, it's not far away. It's not taking that long. It's like 30 minutes. In actual fact, it could be 40, 45 minutes. But, that's kind of what I told myself. I'll be like, oh, that's okay. Those places are not too far. I know those areas. So I went through my orientation, and then I started seeing patients by myself. So just in case you're wondering what it's like to be a home health care nurse, I'll tell you what my experience was. So, of course, when I was on orientation, I learned that you have to schedule the patients, give yourself enough time to get there, and all of that good stuff. So that's the same thing I'm going to mention to you about how home health care nursing kind of works from the nursing perspective on a day-to-day basis. So I got a tablet from the job or for the job, and let's say I'm starting to go see patients by myself tomorrow. Today, I would look at my tablet this evening. I'd have a list of patients that I was going to go see tomorrow. Now, the list of patients is on my tablet. I can click on the patient and get the patient's phone number, the patient's address. I could also click on a certain button in the tablet, and it will map all my patients on a map. So I'd see where everyone is and kind of decide, do I want to start from the patient that's furthest away and then work my way back home? Or do I want to start from the patient that's closest to me and work my way to the patient that's furthest away? Or see the one that's close first and then make my way to the one that's furthest and then work my way back. So I'd look at that and decide, okay, who am I going to see first, second, third, fifth, and sixth? And then I would give everyone a time on my little notebook. Okay, I'm going to give this person from 9 They usually advise us to give the patient a 2-hour window just so you have enough time to get there, find parking, and then go see the patient. So sometimes I'd give an hour and a half to a 2-hour window. So maybe I'd call the first patient. Hey, how are you? My name is so and so. I'm from this agency. You have a nurse visit tomorrow. I'm going to be in your area between 9 o'clock and 10:30 or 9 o'clock and 11 a.m. to see you. Can you confirm for me? They'll be like, okay, yeah, I'll be here. Thank you very much. Thank you very much. I'll see you tomorrow. So I'd go down my list like that, call everybody, and have everyone all lined up. So now I do this ideally the evening before I go see the patient. So then I started noticing that my patients weren't all in the same place. But I was like, it's okay. All these places aren't too far away anyway. And then the next day, I drop my son off at school, and then I'd start seeing the patients. And I started noticing that, these cities aren't too far from each other, but they are far because I'm having to go see a patient here, and then I have to drive 20-30 minutes to go see the next one. I have to find parking, spend time with the patient, and move on to the next patient. In between all of this, I have to use the bathroom. I got to find somewhere to go pee. I have to eat something as I go around to go see the patients. So I started finding out that I was taking documentation home. I wasn't really taking note of these things until I noticed they were happening like almost every day over and over. It was taking me time to go see all my patients because they were so far away from each other. I was doing 3, 4, 5 cities a day. And I would call the other nurses that were there already. How are you doing this? One of the nurses that I oriented with, she told me she was finished with her work at 2 p.m. At 5 p.m., I was still working. I was still on the road seeing patients. I was like, maybe she's some kind of super nurse. Maybe I can't do what she does because I really don't know how she does it. So I called another nurse. Oh no, one day me and another nurse were talking. Either she called me or I called her. I still had like 2 or 3 patients to see. I think maybe it was like 4 o'clock. She was done for the day. I was like, oh my God, what are you doing? What am I doing wrong here? And they would all tell me, with time you get better, you know how to get your patients together, you'll be okay. So I said, okay, it will get better with time. When I say to get better with time, this is what was happening with me. I'd get all these patients. I'd call them the night before. The next day I'd go see my patients. And I would usually wind up bringing home documentation with me. Not only that, I was getting home later than I anticipated. I was getting home around 6 o'clock, 5:30 in the evening. And once I got home, I'd start doing my documentation because I didn't want it to roll over to the next day because I knew I was going to have documentation to do the next day. And I didn't want to have to do that documentation plus the documentation from the previous day. So I'd come home and I'd be documenting. My kids would be around. I'd be here with my kids, but I wouldn't really be here. I'd be working. So I do all the documentation. And remember, I still have to call the patients for the next day. Sometimes I'd get the patient. Sometimes I wouldn't get the patient. So if I'd left a message, the following morning I would follow up again and call to try to schedule everyone. So a typical day would go like this. The night before, I'd call the patient, schedule everyone. And then the next day, I'd start driving to the patient's home. I'd drive to the first patient, do a set of vitals, do some teaching. If the patient had a wound that needed to be dressed, I'd do wound care. If there was anything the patient needed that I could order, I'd order it. If I needed to call the patient's doctor for anything that I'd noticed, abnormal vital signs, something I found out during the assessment, I would put out a call to the doctor. Remember, you are out there working by yourself. If you see something wrong, you need to do something about it. You have to do something about it because what if things end badly for the patient? What if you go to the patient, you see that one occasion I went to see a patient. I'd never seen this patient before. I got there, did all of my assessments. I'm checking the patient's leg. She kept telling me about how her leg was hurting. And this patient literally just came back from the hospital like 2 days ago or something. And I look at her legs, and one of her legs is swollen, is red, is bigger than the other one. I'm like, no, this is not normal. I need to call your doctor. So I called her doctor, and guess what? The doctor didn't even let me finish. She was like, she needs to go to the ER, call the ambulance, blah, blah, blah. So, of course, I called the patient's daughter. I told her I was going to be calling the ambulance because the patient needs to go to the ER. The family agreed, the patient agreed. I called the ambulance. They came, they picked the patient up, and the patient went to the ER. The patient wound up getting admitted for something else. I think maybe they did Dopplers and it was negative, but she wound up being admitted to the hospital for a cardiac reason. So things like that. So I would go see a patient, do vitals, do my assessment, do some teaching. And if the patient needed anything or I had any finding that needed to be reported, I'd start making phone calls. After I see the first patient, I drive to the next patient. Do the same thing, do my assessment. The only thing that may be different from patient to patient may be that one patient needs wound care, the other one needs a fully change, right? So everything is the same. Assessment-wise, you do your vitals, you do your education, you do your physical assessment, you listen to the patient's lungs, all that good stuff. That's standard throughout all the patients you see. The only thing different becomes if they need a procedure or some kind of special education, maybe how to self-administer their antibiotics. So I do this, but I'm traveling from like city to city. The parking is different in every city. Some places I find parking right in front of the patient's house. Some places I have to circle around like in a circle that keeps getting bigger and bigger and wider, looking for a place to park. So I'll make like a big circle and start coming back, making the circle smaller and smaller, hoping maybe someone moved their car, I can find parking, something. So all of that takes time, which means I was spending more time on the road, getting home later, and bringing documentation home with me. And I would keep telling myself, maybe it will get better. Maybe I'll get faster with my charting. Maybe this will change. Maybe that will change. Maybe they'll start putting all my patients together in one place. Nothing changed really. Everything stayed the same. One day I'd called all my patients the night before, and I was literally about to park and see the first patient. I got a call from the office that all of my patients for that morning had been kind of deleted from my tablet, except one, and that I was getting all new patients. And that was really frustrating. I was literally trying to get the hang of this job and kind of make it work for me. And this was kind of messing up my flow because I was really working hard to stay positive and make the job work. So I kind of had to start calling all those patients. I parked my car and I had to start calling all the new patients. Remember, I have to kind of refresh my tablet to kind of have all the old patients get deleted away and download the new patients and go in to get their numbers and start calling them and scheduling them. So stuff like that will happen from time to time where I'd get called to go see a patient. One time I had to drive almost 40 minutes from where I was to go see a patient that had to be seen now. And after seeing that patient, I had to go home because it took a long time to provide the care that patient needed. Anyway, my days went on like this, and this job was Monday through Friday. So every day I was going to see patients. Every day I was bringing home documentation. Every single day I had documentation to do. I was making phone calls to doctors. I was making phone calls to the patients. I was making phone calls to the pharmacies. I was placing orders for the patients. Because remember, you're the case manager. You're also the nurse for this patient. Eventually, I started doing admissions, discharges, pretty much everything. And I felt like the job had taken over my life. I was always documenting at home, on the job. I was just like constantly documenting, and I also got calls from patients, which I didn't mind sometimes. Um, I had a patient that had a PIC line, so I always took the calls from that patient because I didn't want that patient to get an infection or anything, and if there was anything I could do to help, I wanted to help this patient. So when I would take those calls, I didn't really get to, that point system that we have. I didn't really get to put that on the point system, so it didn't really show that, that work was done. But after I spoke with that patient, I would go write a note, because what he was calling me about sometimes required me calling the hospital or calling his doctor to relate to them what was going on with him and what they wanted to get, for him to do, or for the patient to do, or for him to go somewhere. So I tried my very best to make the job work. I felt like I was getting paid a lot of money, and so of course I'm going to work hard at this job, but I felt like the amount of work I was putting in was too much. I was working about 70 hours a week, and I didn't get paid any overtime. It was a salaried position. I forgot to mention this at the beginning of the video. It was a salaried position. There was no overtime. So even though I was working 60 to 70 hours a week, I was only getting paid for 40 hours a week. So I did this job for how many months? I did this job for 4 months, about 4 months. And I decided that I couldn't continue with the job. I wasn't really looking for work-life balance per se. I was looking more for flexibility. There was no flexibility for me. I didn't get the kind of flexibility that I was looking for. So the flexibility was not there. But also, the work consumed my life. It was all I did, all I talked about for those 4 months. So I started telling myself, I have to leave this job. But then another voice in my mind will be like, try and make you work. Try and make you work. Try and make you work. You're a hard worker. You can do this. At one point, I had to tell myself, I work hard, but this is not worth it. I'm working 60 to 70 hours a week. I'm only getting paid for 40 hours. I am not spending any quality time with my family. Even though I'm here, I am working. I sleep, wake up, I am working. I am always working. At home, I'm working. On the job, I'm working. It's too much. So one day I told myself, you know what, I have to resign. I have to resign this job. There are other jobs out there that won't take this much of my time. And if it does, I think I should get compensated. And so I put in my notice at the job. And I did my last day there. And that was it. I left the job. I am still in the ICU, working night shift. And I'm still looking for another job that would give me some flexibility. Hopefully a remote job. My friend that's a case manager is still doing case management, working from home. So I'm hoping I get something like that. I still could do home health care nursing, because I spoke with other nurses that have had a different experience of home health nursing at other places, where all they did was maybe just admissions, or they only did the visits, or they only did wound care, as opposed to doing everything. So I might look for another home healthcare job, but this time I think when I go to interview, I know what to look out for, and what questions to ask, especially what the job responsibilities would be, and if it's everything, I know not to take that job, and if it's something quite specific, maybe I could try. I hope this video helps someone out there that's thinking of becoming a home healthcare job nurse. It's an awesome job. I really loved taking care of the patients. I loved going to see them. They had such a big smile on their face when they would see me. I really liked it. The only issue I had was the amount of time it was taking out of my life and away from my family. So if you're looking for a home healthcare job, I hope you found some useful information in here, what to look out for in your interview, how to negotiate your pay, your job responsibilities, and time management. All right. Thank you for listening, and I'll see you in the next video. Bye-bye now.